This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. For a Connecticut family of 4, the United Way of Connecticut found that it costs $126,000 just to meet their basic needs. That's more than 4 times the federal poverty level. Food insecurity is a big part of this affordability crisis, with 1 in 10 Connecticut residents struggling. That's a statistic from Connecticut Foodshare. And just a quick note for our listeners that Connecticut Public recently partnered with the organization during its fall pledge drive. And coming up, we'll hear more about Foodshare's efforts to address food insecurity where we live. And we'll also talk about an income-based grocery store coming soon to Hartford, which has the highest rates of food insecurity in the state. Plus, Hartford High School just launched the Grub Pub, an in-school pantry, and Principal Flora Padro joins us later in the hour. But first, here to help us dig into this very complex issue of food insecurity is Dr. Caitlin Caspi. She's an associate professor in the Department of Allied Health Sciences at the University of Connecticut. She's also serving as the Director of Food Security Initiatives at the Rudd Center for Food Policy and Obesity. Thank you so much for joining us today, Dr. Caspi.
Happy to be here.
And for our listeners, if you are struggling with your food budget or if you have questions about this issue, please give us a call, 888-720-9677. That's 888-720-WNPR, or leave us a comment on Facebook and Twitter at Where We Live. So, Dr. Caspi, fresh off the presses, the USDA just released new numbers on food insecurity. Can you tell us what you got from that?
Sure. It's a really timely day for us to be talking about this because the newest numbers just came out yesterday. They reflect food insecurity prevalence in December of 2022. So again, these are the most current numbers we have, and they showed that overall 12.8% of U.S. households were food insecure in 2022. And it's notable that this is a meaningful increase from the 2021 numbers that we had when it was 10.2%. So you had mentioned the 1 in 10 statistic, and that's the numbers we've been going off of. That number was steady throughout most of the pandemic, but we are seeing a rise in those numbers.
And so you mentioned the pandemic, and we know that COVID-19 has been a major stressor for a lot of issues, and especially for food insecurity, and it brought a lot of people to food pantries that had never been before. And so having just talked about the new USDA numbers and with this kind of sort of delayed spike, does that surprise you at all?
Well, to some extent, yes, but in other ways, it makes a lot of sense. And I think these numbers can be explained. So first of all, we all know there was a lot going on during those pandemic years, and there were some really unusual patterns that emerged. Things were really changing rapidly. So, we can all remember at the start of the pandemic, the really large increase in food needs for a lot of households due to a variety of issues, including things like the school closures in March of 2020, supply chain issues we might remember from 2020. And then, the disruptions have changed over time, but there have continued to be disruptions that have affected how people are getting their food. So most recently in 2022, I think one of the clear sort of changes was the high inflation and rise in food prices that we saw that peaked in 2022. To some extent, we would have expected a large increase during the pandemic. But what happened was that at the same time as we had changing food needs, we also had a very large federal policy response. And what it did was provide support people during a time of kind of unprecedented need. And it helped ensure that food insecurity rates didn't increase dramatically, or that we couldn't really see that dramatic increase because of the supports were to some extent curbing a dramatic rise during the pandemic.
And you just mentioned policy response from the federal level, and I want to get into that in a second. But I also want to ask you, how else has food security changed since the pandemic began? You mentioned there's so many disruptions like the school closures and and the supply chain issues and just so many different kinds of disruptions that happened over the last couple of years. But with those disruptions, what sorts of solutions have been eliminated from that, you think? Illuminated, I mean.
Sure. So, one thing that's pretty clear was that early on in the pandemic, households with children were at very high risk. Again, you had children who were typically fed at school, and when those school closures happened, they were not able to get food through their usual channels, including the National School Lunch Program. And so very quickly, there was an expansion, new programming in order to support households with children. So we did see some signals very early on in the pandemic of households with children facing higher food insecurity on some measures. And very quickly, I think the policy response demonstrated that that it was effective, and food insecurity rates for households with children did not rise, according to, say, the 2021 numbers. And so I think we can really see in these numbers that swift and sort of far-reaching policy response was really beneficial and averted what could have been a much larger disaster.
Well, and you mentioned children just now, too. And I think the Connecticut nonprofit Data Haven found that food insecurity nearly doubled between 2021 and 2022 for Connecticut parents. And they attributed the jump in part to the end of the child tax credit. So with that in mind, are there other policies or programs needed as we sort of continue this conversation?
Yeah, well, you mentioned the child tax credit, and I think that that's a really large part of what we are seeing about the change between 2021 and 2022. So in 2021, households with children, most of them were getting a monthly benefit for the second half of 2021. And we know that child tax credit money was used to really curb food insecurity and bring children out of poverty. We know that it was effective in doing that. And when that was taken away, you can see the impact pretty clearly. Now, the other thing that was happening at the same time was that there's a program called SNAP, or the Supplemental Nutrition Assistance Program, and those benefits were increased quite substantially during the pandemic, so that all households, for the most part, including households in Connecticut, were getting the maximum amount allowed for a family of their household size. But those benefits ended earlier in 2023, when the public health emergency expired. So SNAP, we talked about child tax credit. SNAP and those expansions were a really key part of the response. But what I think we can gather is that because we saw benefits actually reduce in 2023, that it could be that we haven't even seen the peak of food insecurity rises yet. And we might see another increase next year because of the kind of additional waning of these supports beyond the child tax credit.
And so while this is on our radar, I kind of want to zoom out a little bit here. In 2021, you wrote a piece addressing some misconceptions around food insecurity, for example, how it fits with other food access concepts like hunger and food sovereignty. I want to talk about, has public awareness around those misconceptions improved or worsened, or what does that look like?
Yeah, I think that the pandemic really forced us to pay attention in a way that we weren't before. And look, I think we weren't paying attention potentially because as a very wealthy nation, why should food insecurity be a problem? We have enough food produced in this country. there is a perceived there's a real focus on the obesity epidemic and rising rates of obesity. And so, through that lens, and the sort of lens of the wealth of our nation, it seems kind of inconceivable that 1 in 10 families could be facing food insecurity. But the last few years, of course, has sort of shaken up people's experiences quite a bit. Many of us had to make adaptations to our food habits at the start of the pandemic. Many of us have gone to the grocery store and been really shocked by the rise in prices. Many people saw in the news in the early stages of the pandemic lines forming outside of food banks. And so I think people had a growing consciousness of how little it takes to not know if you're going to be able to afford groceries.
Right. And I myself have been a part of a lot of reporting, seeing those lines increase in ways that I did not expect as a reporter. And you mentioned, this has changed over the last couple of years, and it's difficult to have this conversation without mentioning that we've gone through a pandemic, and in a lot of ways it's still ongoing. So how have your feelings about this issue and your role as an advocate evolved over time? Are you seeing there's more need for advocacy? There's more need for awareness spreading? What are your thoughts on that?
Yeah, absolutely. And I think the awareness has grown and we're there. We're having the conversation like we are today. So I'm really grateful for that. Another way, though, that I think that the conversation has evolved is that previously there was a lot of the conversation really focused on geography and where people live, specifically whether or not they lived in a so-called food desert or what we call food desert, which is a low income area without access to healthy and affordable food. And I want to be really clear that it is a real problem if you can't access healthy and affordable food in your neighborhood because there's no store, or you can't access it because of transportation barriers. And that is a real problem for residents of Connecticut, and it's a problem across the country. So a healthy food environment is really essential for health and for eating well and maintaining food security. But at the same time, I would say that it's not what we might call a fundamental cause of food insecurity. And so when we're thinking about the solutions to food insecurity, it's helpful to think just a little bit more about the more fundamental causes. Food insecurity isn't happening in a vacuum. It's really intersecting with a lot of other challenges that people face. It intersects with a lack of stable housing, lack of health insurance or job security. It happens because of disability. And because of all of these things, I would say that food insecurity isn't primarily a story about food so much as it's one about sort of many facets of economic instability.
And I love that you mentioned that, just because we've been talking about food insecurity, but words matter. And so you mentioned that the USDA retired the term food desert in favor of low income or low access areas. So glad to sort of dispel the misconceptions there. And at the top of the hour, we also mentioned, too, that the federal poverty level, which is largely based on the cost of a minimum food diet, what are some of the other metrics that you lean on to really determine food insecurity, and how much has changed since we started to sort of measure that poverty level?
Well, so the level, the way we measure food insecurity has stayed the same for several decades in the United States. So we do have this sort of consistent measure. That's really helpful in order to be able to measure change over time. One, I would say, change that's happened is that we use the term food insecurity to talk about a household level economic and social condition where people have limited or uncertain access to adequate food. And that's quite different than talking about hunger or using the term hunger, which USDA used to use to think about sort of the individual, but now that term is really used to talk about individual level physiological condition of being hungry. And so when we're talking about food insecurity, we're really talking about that social and economic condition. I would say that in the last year or two, there has been an increased focus on the terminology nutrition security and the concept of providing food not just in adequate quantities, but also in in adequate quality, so that it promotes health and well-being. And so you're seeing an increase in kind of a call to measure not just how much food people are getting, but the quality of the food that people are getting.
Well, Ian, you just touched on the quality of food, and you've also done a lot of research on how food pantries are utilized and how healthy foods are really important. And so can you touch on that research and what does that look like?
Absolutely. So there's a lot of supports that people could get in order to address food insecurity, federal nutrition assistance programs, but half of people facing food insecurity are not using programs like SNAP for a variety of reasons. It could be due to eligibility or a sort of stigma associated with those programs. And for people who can't access or are not accessing programs like SNAP, food pantries and the charitable food system have become a really integral part of the way that they're meeting their own food needs. And so I've done quite a bit of work in trying to change those spaces so that they are both more welcoming, less stigmatizing places to visit, places where you can access healthy and appealing food without with dignity. And also places where that promote health. So where clients have a choice, they have in what they take. They might be set up much more like a grocery store than like a place where you can get a handout. And people can sort of meet the needs of their own families.
Well, I feel like you can read my mind because I wanted to ask you more about how stigma factors into a lot of the data that we're discussing. Can you touch more on that?
Sure. So I guess we're going to go back to those initial numbers that I discussed at the very beginning. And I think it's important to note that those numbers might really be underreporting.
Sure.
Food insecurity, it's 12.8%, and that's from a nationally representative sample. But food insecurity is likely to be underreported the same way. Any sort of stigmatized condition is going to be underreported, and so that's kind of critical because the problem with stigma is you have a lot of people who need resources and might be eligible for resources but aren't getting them.
Right. And we'll be digging more into that in our next segment. You've been listening to Dr. Caitlin Caspi, who's an associate professor in the Department of Allied Health Sciences at UConn. And she'll stay with us as we continue this conversation with Connecticut Foodshare. And for our listeners, if you're affected by food insecurity, you can give us a call, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. This hour, we're discussing food insecurity in Connecticut and some of the efforts to address it. In Hartford's Frog Hollow, a new grocery store offering income-based prices is set to open in January. The Hartford Courant reported that the store comes after decades of debate over how to expand shopping options in Hartford. And joining us now to discuss is Jason Jakubowski, President and CEO of Connecticut Foodshare. Thank you so much, Jason, for joining us this morning.
Very happy to be here today.
And we also have with us is Ben Dubow, who is the executive director at Forge City Works, which is a Hartford-based nonprofit that will operate the Grocery on Broad. Thanks, Ben, for joining us today. Ben, are you there?
Yep.
Oh, Ben is there. Whew.
Yep. Good morning. Good to see you.
Good to see you too. And for our listeners, you can also join the conversation, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So Jason, I want to start with you. You've been listening to our conversation with UConn's Dr. Caitlin Caspi. What would you add to some of the misconceptions around food security, which is what we were just talking about earlier?
Well, first of all, I agree with everything that Dr. Cassidy said. I mean, especially in light of the USDA report that was issued yesterday. I think the biggest misconception that there is right out there is that things are significantly better than they were during the pandemic. Things are different than they were during the pandemic, for sure. No question about that. But I've been at this for many years now, and I don't know if I would say that things are better than they were at the peak of the pandemic. Yes, we do not have 2,500 cars a day at Rentschler Field lining up. We don't have that visual. But what we hear from our 600 pantries across the state, and we see it ourselves at our own mobile sites, people are hurting right now. There's a lot of people who are dealing with food insecurity because, as she said, a lot of the federal stopgap measures that were put in during COVID to attempt to divert catastrophe were effective. Many of them, if not all of them, have gone by the wayside now. They've expired. And now you've got a situation where, we're not in the middle of a pandemic, but we are in a situation in which individual families are struggling because they don't have the child tax credit. They don't have the moratorium on student loan payments, on rent, et cetera. So it's about as bad as we've seen it in a while.
And Ben, following what Jason just said, especially with a lot of the relief programs have ended or are ending, and we have talked about a lot of issues that were exacerbated by what's been going on the last couple of years. What have you seen? What would you add to what Jason just mentioned?
I would totally agree. And the statistics, I think, bear that out. I will say, from our location right in Frog Hollow, a neighborhood in Hartford, we see food insecurity and certainly lack of food access. It's a persistent and ongoing are that has been present for as long as, I can speak to, and longer than that, and continues to be. So, there are definitely areas, I think, of the state and of the populace that are experiencing food insecurity in ways they haven't before, or, and I agree with what Jason is saying. But I'll tell you, in our neighborhood in Frog Hollow, it has been a persistent and consistent problem for decades.
Right. And I think a lot of these issues are pre-pandemic, right? Just exacerbated with what's been going on. And we've been talking about solutions as well, and also mentioning that you're helping launch the Grocery on Broad in Frog Hollow here in Hartford. Can you tell us about this project? What has that been like?
So it's a really exciting project we're working on. It'll be a small neighborhood grocery store. It'll be means tested, which means that there'll be a sliding scale pricing model. So depending on where you are in terms of your finances, there'll be a self-certification system. There'll be discounts available on the listed price up to 50% or 25%, or for everyone who uses the store, at least a baseline of 3%. And the idea is we want people to sign up to get those discounts. And when they check out, they'll simply swipe a card when they check out with the cashier, and the discount will be automatically applied, right? So no one has to know who's on the discount. No one has to know who's getting supplemental stuff. And it really destigmatizes the whole process of fighting food insecurity and providing food access.
And so this is a process that's been going on for a while, and it's also a very creative solution to at least a couple of problems. You told the Hartford Courant that it's a dignified way for people to get food, and also helps address this neighborhood's very long-standing grocery program, as you have just mentioned. Can you first talk about this issue of stigma and how you see and address that? Obviously, this grocery store will play a big role in that.
Yeah, we know both from data, but also from listening to people's stories and, connecting with people on the ground, that there's a persistent stigma around getting food assistance or any services, and that in and of itself often is a barrier to people getting the resources and the services they need. And so I first encountered that when I was helping run the soup kitchen and the food pantry in Manchester, Connecticut. And we would look at those issues and try to figure out ways to destigmatize and really make it a more dignified process. And so for us, this idea of a grocery, again, it doesn't replace pantries. It doesn't solve the big grocery problem in Hartford,
Right.
but it provides in one neighborhood, in a small setting, an opportunity to provide healthy, wholesome, real foods at prices that make sense for people and they can afford in a way that preserves and celebrates dignity by coming together with a diversity of customers so that we're all shopping next to each other, kind of picture kind of a co-op kind of model. And we're all in it together as our neighbors, and no one has to know, again, who's getting the help. So we think that that's going to be really helpful in terms of eliminating the stigma and really emphasizing kind of a sense of belonging and inclusion and all those things are really important.
And as this is launching too, are you hoping that this will become a model for other neighborhoods, not just in Hartford?
Yeah, our hope is that this definitely is both a scalable and reproducible model by other groups who want to run with it. In fact, we're already having some conversations with some other nonprofits in the north end of Hartford, other neighborhoods who are trying to learn from us in live time as we go through this process. And so again, I don't think this solves the big grocery problem in Hartford, but I do think that small neighborhood markets with this kind of a model, in particular the fresh food access in neighborhoods throughout the city, can certainly in a short term kind of fill some of the gaps that we know exist.
And Jason, I know this is a long-term problem, but with the grocery store coming in as a short-term solution, as what Ben was just saying, can you talk about Connecticut Foodshare's involvement here? What's the timeline like?
Yeah, absolutely. We're hoping to open. There's a lot of permitting, obviously, involved in it. There's a little bit of build out that we have to do. We're very grateful that Connecticut Foodshare received a $250,000 federal grant through Congressman Larson to do this project. And once we got authorization for that, we started working with Ben and his team over there on the build out, on the designs. I know we're on radio, so you can't see the actual pictures, but I'm looking at the beautiful schematic designs. It's been a labor of love, I think, for a lot of us from the time that we've gotten the federal grant to do it. And I know you had asked previously about replicating it in other places. We always went into this with the theory that if this works, it is absolutely replicable in other spots around the city. I'll admit every time I run into Mayor Bronin, he's asking me, "Hey, when can we do one of these up in the north end?" We've had some conversations about, if this works. I mean, this is a model that we could do. In terms of the dignity piece, though, I mean, what Ben was speaking to is very similar to what we're seeing across the country in terms of food banking and in terms of food pantries and how we're helping people who are affected by food insecurity. 10 years ago, it was, hey, I'm hungry, and so you go to a pantry and they hand you a bag of food, and that's not as dignified as taking a shopping cart and going up and down the aisles and being able to select your own product and pay for it in a way that, like Ben said, nobody has any idea when you're paying, what discount you're getting. That's a shift, not just in terms of this grocery model. I mean, that's a shift that we're seeing and we're trying to promulgate at all of our pantries across the state of Connecticut.
And Jason, we're talking about Hartford this hour, which has the highest food insecurity rate in the state, as we mentioned earlier on the show. But how does this issue show up elsewhere in Connecticut? We know it's not a Hartford unique problem. For example, can you talk about your concerns perhaps in more rural areas?
Oh, absolutely. Look, I mean, the biggest misnomer that we have, and I see this every time I go to a national convention or something, and they look at me and they say, "Oh, you're from the food bank in Connecticut." And, there's always a joke about, how wealthy you all are and your yachts and everything. There is absolutely a misperception. Well, look, Connecticut is the richest state in the country, but there is this misperception out there that there is not a problem with food insecurity. There's about 400,000 people in Connecticut who are food insecure, and it's not just Hartford, Bridgeport, New Haven. We serve at least one family in each of the 169 towns here in Connecticut. So that goes for a major city like Hartford. It goes for a suburban place like West Hartford. It goes for rural towns like Cornwall. And, you kind of alluded to this in the question. There may not be a lot of grocery stores in some of the urban centers. There's certainly not a lot of grocery stores in some of the more rural parts of Connecticut. And, Connecticut is a very rural state with a lot of urban centers. So it's a difficult thing for us just on a daily basis, figuring out how do we deal with the urban centers, the suburban areas, and the rural areas. But the problem is the same. The approach and the solution may be a little bit different, but at its core, it's the same. And just because we're a wealthy state does not mean that we have no issues with food insecurity here.
Right. And we've been talking about specific neighborhoods. You've just mentioned certain rural areas that can be a really big concern for food insecurity. I think another area that we don't often talk about or think about is that it's even higher among college students. Swipe Out Hunger is a national advocacy nonprofit, and they found that at least 1 in 3 college students is affected nationwide. And I covered the state general session earlier, and that was a huge conversation amongst the state reps about it. So can you touch on that? How big of a problem is it here in Connecticut, Jason?
Yeah. Oh no. Look, it's a problem. We're doing more to solve it today than we were 5 or 6 years ago. When I started at Connecticut Foodshare, it was a conversation that had just begun. I remember being with folks from the Rudd Center and with Senator Murphy up at UConn doing a student roundtable, and UConn did a lot of research in terms of where student hunger was at. We have pantries at many of the colleges and universities here in the state of Connecticut. We've had some that we've had for more than 10 years. We have others that we've recently onboarded. Again, UConn is a great example. Over the last year, we just opened the Husky Harvest pantries at each campus. Stores, the 4 regional campuses, plus the School of Medicine and the School of Law in Hartford. And a lot of people look at a college campus and say, well, everybody's on a meal plan. Why do they need food? Again, not true. You have a lot of people that are commuter students. You have a lot of people that are on significantly fixed incomes, and being able to work with the university and get that done was great. So there definitely is a recognition. You alluded to the state legislature a couple of years ago. They did pass a requirement that every public higher ed institution every October has to report its food insecurity number to the state. That was basically an initial laying the initial groundwork for the fact that yes, the state was going to be serious about tackling college hunger.
And Dr. Caspi, with what Jason just mentioned, with the partnerships too with UConn and the food pantries for students, you're also the director of food security initiatives at the Rudd Center for Food Policy and Health. Can you talk about your work there and how this issue really hits home at UConn and beyond, really?
Yeah, there was a substantial amount of work, particularly during the pandemic, that was done to try to get our finger on the pulse of the problem. Much of it was done before I arrived at UConn. So I want to give credit to my colleagues, Kristen Cooksey-Stour and Marlene Schwartz, for leading those efforts at the start and prior to the pandemic. But as a result of a lot of these efforts, there has been much discussion and the opening of food pantries on campus. And then I think another piece of the conversation that's really been moving forward is how to expand SNAP eligibility for college students. This is a conversation that's happening nationally, not just in Connecticut or at UConn. And during the pandemic, SNAP was some of the requirements were relaxed, and SNAP was more accessible to students. But again, I think this is a really important conversation in kind of addressing the problem in a population at risk.
And Jason, as we continue this conversation, what are some of the primary policy solutions you'd like to see, especially with a lot of relief programs either phasing out or has phased out?
Oh, we could go on forever about the policy solutions.
We've got a couple of minutes here, Jason.
Look, absolutely correct in that, pantries are great. They're wonderful. SNAP is absolutely the first line of defense against hunger. For every meal that a food pantry or a food bank can provide, SNAP can provide 10 or 11. That is the first line of defense. It's a dignified way of helping individuals and helping families. Obviously, we are always encouraging Congress to increase the SNAP benefit, increase SNAP eligibility as much as humanly possible. I think the other piece of it is you look at things like the child tax credit. Perfect example. People don't think of that as directly as combating food insecurity, but it absolutely does. People are hungry go hungry because they're making choices in their life. Do they pay for child care? Do they pay for school? Do they pay for electricity? Do they pay for medication, or do they pay for food? That helps take that lessen that decision. So those are things the federal government can do. The state government, we've been having great conversations with a number of legislators about increasing the state's nutrition assistance program, which is the amount of food that the state buys and provides to our pantries. That definitely needs to increase. Our pantries are really hurting, and we're hoping that in the next legislative session that we will that they'll make a significant increase in that.
And Ben, we got about a minute or so here, but also would like to ask, any final thoughts, especially as you launch the grocery store, any solutions that you would like to see?
Again, reiterating it's got to be across the board, right? These are such intersectional issues, and how we provide really income and money and workforce development, which is the other thing that we do, and all those kind of things is really all together really critical. And it's going to take a lot of pieces of the puzzle to make a difference. And we need to kind of look at all these creative solutions as we move forward.
You've been listening to Ben Dubow with Forge City Works. Thank you so much, Ben, for being with us this morning.
Well, great to be with you. I appreciate it. Thank you.
You've also been listening to Jason Jakubowski at Connecticut Foodshare. Thank you, Jason, for joining us today.
Thank you. Great conversation.
And we also have Dr. Caitlin Caspi, who's a UConn associate professor. Thank you so much for breaking down everything for us today and helping us understand the situation better.
Thanks for having me.
And coming up next, we hear about the Grub Pub at Hartford High School, which is a new in-school pantry. Principal Flora Padro joins us after a break, and you can join us too. Give us a call, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. This hour, we're discussing food insecurity in Connecticut and some of the solutions. At Hartford High School, a new in-school pantry is helping students to stem the tide. According to Hartford Public Statistics, 75% of students receive free or reduced price meals at school. And joining us now to discuss is Principal Flora Padro. Thank you so much for joining us this morning. Are you there, Principal Padro? She might not be there, but that's okay, because I am going to quickly bring back Dr. Caitlin Caspi, who's a UConn associate professor. Welcome back for a segment, Dr. Caspi.
Hi, how are you?
Good.
I'm excellent. Thank you for asking.
Oh, do we have Principal Padro, are you on? I think we're having a little bit of a technical issue here, but that's okay. Dr. Caspi, I want to talk about the importance of school pantries while we figure out what's going on with our lines this morning. We've been talking a lot about stigma. We've been talking a lot about needing solutions. So can you talk about, has the pandemic changed school pantries? Has that culture changed?
I think our guests will be able to speak a little bit more to what's happening in the local area. But we did see, an expansion of pantries, new models pop up during the pandemic when people were trying out new ways of getting food to families. And school pantries have emerged as a really important piece of that. I also want to go back to something that we discussed in the last segment about sort of the role that food pantries are playing for households. I want to emphasize that in my own research, we found really that people who are relying on food pantries are relying on them for a really large amount of food. So while we might think of these food pantries as playing just sort of a maybe minor or supplemental role, they really contribute to a large portion of the food that people are providing. So in my own research, we found, if we've surveyed people who are using food pantries, we found that half of people are saying that they get half or more of their total food from the food pantry when they're visiting. So really, the more resources, including school food pantries, that we can use to sort of bolster people's pantries and allow them to cook healthy meals at home, the better.
And just want to take a quick moment to check in if Principal Aflora is on.
I am on.
You are on. Thank you so much for being on. Happy to hear you.
Thank you for having me.
Of course. So we were just talking about how important it is to have school pantries in high schools, middle schools, and whatnot. So can you tell us about how the Grubhub got started and a little bit about how that pantry works?
Absolutely. So I think the pandemic definitely shined a light at some of the struggles that we were seeing with our students across the nation. Coming back from the pandemic, those struggles did not go away, and we wanted to ensure that the schools had ways of really supporting students, not just academically, but across all areas of disparities and support. So we started brainstorming, like, what are the great needs? We have a mixed population. We have 800 students at Hartford High. It is the largest comprehensive in the city of Hartford. And so we wanted to ensure that we were meeting all sorts of needs beyond the social, emotional, and academic. We ran across an application from Stop and Shop. They have a pantry program within schools that is national. We took a chance, we applied, and we were actually awarded $20,000 to begin this food pantry. Fortunately, that was only the beginning. In addition to being able to have this large award, we were able to get different corporate sponsorships to aid in providing supplies for hygiene. So we have a hygiene pantry. We were able to expand a food pantry and create a clothing pantry. And we are actually in the process of pushing out a laundry service for students that may have struggles with accessing that as well. It was super important that we were able to support all students. We have a high international population, and as I stated, it's students with varying needs. And so it was important that we were able to provide any family with a food insecurity or food need the opportunity to have access to nutritional meals.
So I definitely want to dive into the other services that the pantry is able to provide in a little bit, but I also want to touch on that this is the second year the Grubhub has been running. You know, what has the response been? Has students been using the services? Have they been, excited that this is available to them? What has that been like?
Absolutely. Students are definitely aware that the services are there, as are families. We give out food on a weekly basis. We've actually managed to create several in-house internships where now the Grubhub is helped being managed by student interns, everything from our data system to the actual putting together the bags of groceries and so on. It's a quiet process, right? We don't necessarily, push the bags of food out to the students in a public setting. So students that may be wary of, being singled out or showcasing that they have these disparities are able to obtain what they need in a kind of reserved and quiet environment. Families as well. So the process is the same. Staff help to process the Google form, the applications or the request for food. And, we push it out within 24 hours or less.
And you mentioned laundry services just now too. When will that be up and running, and what does that look like? Can students bring in clothes or get clothes, or what is that?
So we have a clothing pantry for students to get clothes. And with winter season coming around, we give out coats and sweaters and warm gear and so on. So that's a super important part of what we do. The laundry services actually started from a teacher putting in a donor's choose request for a washer and a dryer. we were able to then get the plumbing installed so students can now come in within the next month or so and bring a small load of laundry and be able to, have like an emergency laundry service done.
And so you told Fox 61 Connecticut that these efforts are part of a new normal that you hope to introduce. And you just touched on sort of the importance of meeting social and emotional needs. And I've done a lot of stories too related to pantries where it really is more than just about the food. It's about meeting what the students need beyond breakfast, lunch, and dinner. Can you talk about more about this new normal and how important it is to be able to help these students in their various needs?
The old normal never worked. We had high instances of chronic absenteeism. We had students that were quite honestly choosing work over school because they had to provide food or resources for the families. And this took away from the actual learning. So it's hard to convince a student to bypass going to work to earn some extra cash to meet a need that the family had, especially at the high schools. So we really needed to re-envision what supports or wraparound services look for our students. We're fortunate that we have, medical assistance in the building for students to access that, dental clinic, and so on. We wanted to just expand on those services and ensure that all students were able to, whatever the need was, get those needs met. And what we saw was a decrease in chronic absenteeism by more than 25 percentage points. What we have seen is a steady attendance of 80% daily attendance for the last 2 years. We've seen a significant increase. What we have seen is students capitalizing on our career pathways, capitalizing on internships. We've seen a shift in the culture in the building, and we've seen students genuinely take more ownership and accountability for their own learning. We're creating a community, so it goes beyond just the pantries. It goes beyond the services. It's a shared responsibility for all of us to create a culture in which we're uplifting each other.
So we got about a minute here left, but I do want to ask, what else do you want to see done in your community to address food insecurity as you continue these partnerships and these skill sort of sessions for these students to build on?
Absolutely. So sustainability is always in the back of my mind. So continuing to grow our sponsorships with other partners, but, tying this work to our Ally Health career pathway. There is absolutely no reason that students within our Ally Health program couldn't be helping to expand on what our mission is for educating and providing services that combat food insecurities. So one of the things that we're envisioning and starting is having our pathway students actually create model lessons on healthy eating, nutrition for not just other students, but for the families and the members of the community, and being able to lead that work themselves.
Well, thank you so much for that. You've been listening to Flora Padro, who's the principal of Hartford High School. Thank you so much for your time today.
Thank you for having me.
And also a quick thanks to Dr. Caitlin Caspi, who's the UConn Associate Professor, for staying on the line with us and jumping into the conversation earlier. I'm Catherine Shen. Today's show is produced by Katie Pellico. Our technical producer is Kat Pastor. Download Where We Live anytime on your favorite podcast app. And thank you so much for listening.